there is mounting confusion over the Trump administration's plans to get kids back in school this fall safely. On Sunday, Education Secretary Betsy DeVos didn't say whether or not schools should actually be following the CDC guidelines, and she appeared to sort of downplay the risks of getting kids back into class. Here's what she had to say.
We know that children get the virus at a far lower rate than any other part of the population. And again, there is nothing in the data that would suggest that kids being back in school is dangerous to them.
All right, so for more on this, we want to bring in a New York pediatrician, Dr. Dyan Hes. So, doctor, there still are a lot of questions when it comes to the coronavirus and kids. Initially, we heard that, kids could get it, but it wouldn't be as severe. And then there was, some more studies indicating that maybe they're actually not getting it as frequently as older people are. So, admittedly, perhaps the science may be confusing. Doesn't that make it even more important, though, that we get a unified message from, a federal government or organization telling us how to move forward?
Yeah, but I don't think that's ever going to happen because this country is so divided. If adults took responsibility all across the nation and wore masks, we could have shut this down so long ago. But now children who are not going to be allowed to go to school are bearing the burden of their parents and the adults who refuse to wear masks. I mean, when you look at other countries around the world, there are 0 deaths in Vietnam. It's a totalitarian country, but they've had 0 deaths from COVID because the country shut it down. I mean, we have no way of enforcing quarantines. We have no way of enforcing travelers from other states with high rates from staying indoors for 14 days. So I do want kids back in school. I think where the rates are very low, like in New York right now, we can reopen schools in some kind of blended capacity. But when you have a 10% or higher infection rate, you can't reopen schools.
So, Doctor, I know that there have been a number of officials in the Trump administration at the CDC that have pointed to schools, as you mentioned, overseas that have been able to reopen. And part of what they suggest is that the science is still not clear as to whether or not children can transmit it amongst themselves, or I guess importantly, if you've got children going to school and then coming home, transmitting it to adults. But are there certain factors that these countries took into account before they decided to reopen schools? And I wonder, because we continue to say there is no evidence that children, for example, transmit it to adults, or there is no evidence that children transmit it amongst themselves. But perhaps I wonder, and I'm not a doctor, but I wonder if a lot of that has to do with the fact that this pandemic came towards the end of the school year, and we just don't have any kind of long-term statistics as to what actually might happen if children are exposed to it for longer periods of time, to each other for longer periods of time.
Exactly. So from the articles that I've read, the best studies have come out of France, where they tested kids in February who had coronavirus in high school and some in the elementary school. And they didn't see a huge, large pandemic in that school district. They saw maybe 1 or 2 parents who were probably infected and had given it to their children, and some of the high school children were infected. But there was never like a large amount of children that had to be quarantined. And many of those kids already, when they tested them, already had antibodies. So they probably had COVID back in January, February, and didn't even know. In Israel, there was one large outbreak in a middle school, high school. But what the studies aren't saying is that was also a very, very hot week in Israel. The temperatures were over 100 degrees Celsius, Fahrenheit, like 40 degrees Celsius. And many kids were unmasking, number one, and the teachers, because it was just too hot to bear wearing a mask. They should have closed the schools for that reason. And 2, Israel has, I'm Israeli actually. They have very large class size, so they have 30 to 40 kids in a class, and they weren't limiting class size at that time. So we have to learn from our mistakes. So maybe partially reopening with smaller class size, making sure the teachers and the students are protected and wearing masks. But what I am reading online are there are many states who are not requiring kids to wear masks to go back to school, and this is going to be a total disaster, at least for the older children who can tolerate wearing a mask.
And we got to talk about the teachers too, and the other people who help to run these schools. They are more vulnerable. Looking at a new Kaiser study that found that almost 1.5 million of the teachers, or 1 in 4 nationwide, are at high risk because they have a serious illness, or they may also be older. How does that factor in when we talk about opening up schools?
Well, most of the teachers are in unions, not all of them, and the workers in the school. So I think that's when their unions have to negotiate. We are not going to come back to work unless all of our staff is provided with a mask and or a face shield. And I actually think that if a teacher has diabetes, lupus, rheumatoid arthritis, anything that they're immunosuppressed, multiple sclerosis, cancer, they should have the option to be the teachers who are teaching or working from home. And the same with the tutorial. They should have those options. They should not have to be subjected to die because our country has not provided our staffing with PPE.
I think it's just so important, Doctor, to reiterate what you sort of said in your opening remarks when we first started talking to you, which is, everybody understands the risk factors in children not being able to attend school. Everybody understands that if there is online schooling that is happening, kids who don't have the means to access that online schooling will be at a greater risk than kids who come from families that have the capabilities of providing that for their children, or who live in school districts who have those capabilities. But you said something that I think is just so important, that it didn't have to be this way. We didn't have to come to this point where we're wondering whether or not teachers will be able to survive if they go back to school, or debating whether or not children can be super spreaders or not, because we knew what needed to be done back in March, and we haven't been able to do it.
No, it's shameful. I used to think that the anti-vax movement was a blight on our society, and that America would be, go down in history as like the super educated patients who are not getting vaccinated. And now I think that this coronavirus has far surpassed that we need some kind of federal guidance, which we are not getting. And we are getting politicians involved in making medical decisions who shouldn't be. And we are having our scientists openly criticized by the government, who are not doctors, who are not physicians, who are not epidemiologists. They're not letting the scientists do their jobs. It's very easy. Every other country that has successfully controlled this virus has worn masks. It is so simple. It decreases the transmission rate by 65%. And we just can't get our act together to mandate that.
And we haven't even begun to discuss, there's a big push to get a vaccine as quickly as possible. And given how shambolic our nation's response to this virus has been, a lot of people doctors are wondering what that would look like if a virus is available. Would people even want to take it? What would be the distribution? Would it be equitable? Would people without means and without health insurance be able to access it? There are a whole host of questions, Dr. Hess. And as always, we're so happy that you're able to come on our air to talk about it, and that is something that we want to talk to you in the days and weeks ahead. Dr. Hess, as always, we appreciate it.
Okay, take care.